We have a very, very strong community base here where we live, but there's an isolation element to it. So usually rural communities, mental health is very much not talked about. So I think that's one of the things that has been a bit of an eye-opener for me, because behind closed doors, you deal with your own mental health, but there's nothing, being an older generation community, there's none of that understanding of what mental health is really about. So I think that's a bit of a disadvantage in living in rural communities. Also, access to services is just, it's not there. It isn't. The safety of mental health units needs to be changed, because consumers have a right as any other patient in a system to be safe, be cared, and have input. And I think part of that for me is that you need to be able to go into a health system or a broader social services landscape and feel safe and feel supported. And I think to me, it's lacking, and it's lacking because of consumers not having their right say in how to be safe within the system. I think systems in our mental health unit are very clinical, and it would be so nice to be able to go into a unit and it not be so clinically based. Treat consumers with intelligence, not disrespect, and recovery programs. Like we know in our region there's recovery programs outside of our areas, but we're actually not able to access them because we're not in a catchment area. It would be lovely to have a panel of consumers that would go in and be part of the professional care program. And, I suppose we're the ones who can make those sort of things happen. So it would be so lovely in a utopia to have that consumer base, to be able to have people help each other.